Pneumorrahachis, pneumothorax, and subcutaneous emphysema. Definition. Pneumorrahachis refers to a rare phenomenon characterized by the presence of the air between the spinal cord. A pneumothorax is an abnormal collection of air in the pleural space between the lung and the chest wall. Symptoms typically include sudden onset of sharp, one-sided chest pain and shortness of breath. Subcutaneous emphysema is when gas or air is in the layer under the skin. Subcutaneous refers to the tissue beneath the skin, and emphysema refers to the trapped air.
Glides out from the patient's chest tube site far enough that those little holes in the chest tube are exposed to the atmosphere, and air is going to be rushing right back into the pleural space, and it's going to cause more of a pneumothorax, and it's also going to cause the subcutaneous emphysema. Now, it depends. The treatment for this depends.
Applications in medicine. Pneumothorax is diagnosed in 3 to 5% of patients who undergo spinal surgery along the interior approach, and is usually caused by small pleural injuries. Our patient, no injury of the large airways was present. The patient underwent revision surgery and started radiotherapy 3 weeks after the procedure. No further complications occurred. At the 6-month follow-up visit, the patient had complete remission of the sarcoma and hadn't had a recurrence of pneumothorax or pneumorrhachis.
The tube goes underneath water so that air can escape but cannot enter into the pleural space. So this is the idea of putting a intercostal drainage tube attached to an underwater seal, that gradually air from the pleural space will go out but cannot come back, and that way the lung gradually expands. Now we can enhance this. We give some chest physiotherapy, especially expiratory exercises, which raises the intrathoracic pressure so that air can escape. For example, you can.
The pros. Medications may be necessary to treat a pulmonary disorder that causes the pneumothorax. For example, intravenous antibiotics are included in this treatment of pneumothorax that is developed as a sequela of staphylococcal pneumonia. In addition, studies suggest that the administration of prophylactic antibiotics during chest tube insertion may reduce the incidence of complications such as emphysema. Alright, the cons. Most pneumothoraxes in patients with chronic obstructive pulmonary disease, COPD, require long-term aspiration. In addition, chemical pyrothesis is recommended once the air leak has resolved. Consider surgery if the COPD is severe, the pneumothorax is poorly tolerated, or the air leak persists longer than 72 hours. When tension pneumothorax is suspected, immediate decompensation using a large bore needle placed into the second anterior intercostal space is required. This is followed by the tube thoracostomy. The issue applying in Ecuador. 90% of primary spontaneous pneumothorax patients are smokers. Most patients have subpleural lips, which may be related to smoking, and rare synonyms with emphysema-like changes, ELC. Patients tend to be taller and thinner than the average individual, and most patients are 25 to 35 years old. Pneumothorax is 6 times more common in men than in women. In addition, the tendency to pneumothorax may be inherited. Secondary spontaneous pneumothorax is most common in patients who have COPD. The worse the COPD, the more likely the patient is to develop a pneumothorax. In addition, most patients have subpleural bleeds. Well, the pressure within uh, the pleural cavity becomes too great. Conclusion: what other considerations exist for patients with a pneumothorax? If the patient has the Pneumorrahachis tube syndrome, genetic counseling should be done to inform the patient that the syndrome is transferred to us an autosomal dominant manner. If the patient has the Pneumorrahachis tube syndrome, a CT scan of the kidneys should be obtained to rule out the kidney lesions.
Porque rola pra tempo, doido, tá?
Meu Deus, fica parado.
Calma, calma, mineiro, vai melhorar, mineiro. Calma aí, irmão. Calma. A gente sabe que é ruim, mas vai melhorar. Calma, calma, você tem que relaxar, cara. Pra cá, só um pouquinho, pra cá.
Deixa aqui, vou travar aqui.
Vem pra não cair pra trás, então.
Thank you very much.